my name is Ruby and I am going to be doing a video journal for this week's 4th week. It's my 4th week. And I did my externship Tuesday, Wednesday, Thursday, Friday this week because Monday was a holiday. And I have 4 more days left and I'm completely done with my hours. So I am excited, but I'm gonna go ahead and get started. I don't really remember what happened each day, but I have a list of big things, or at least to me, important tasks that I performed and clinical duties, majority, because our office doesn't do administrative as much, or administrative work, besides the EHR. For skills that I got checked off, most of them I already have done. Besides that, it would be maybe administering oral medication, which I haven't gotten to do yet. And pediatric patients have a vaccine for rotavirus. I didn't get to administer the medication to the patient, but I did observe the vaccine being administered. So that was cool. I think something you just have to watch out for is making sure that you don't make the baby choke on the medicine, because they're little tiny babies and they can only swallow so much liquid at a time. Another thing I have on my list that I was able to do was red top swabs. I was able to check off for immunology and that was good. Someone gave the trick. Oh wait, it was Amy. Amy, you gave the trick. Once they make that kind of face where you're tickling their nose, that's when you know when you hit the sweet spot. So that helped out. Do it in both sides, and it tests for flu, COVID, and strep. And you label it. You print out a sticker, label it, and send it down to the lab, which you gotta walk down there. So if that's technically considered administrative, then that's cool. Something else I have done was an EKG. I've done this in the past a few times prior to this week, but when I was doing it on an elderly patient, the electrodes were sticking so well, and I got corrected on moving the electrodes from the chest to the limb. Now, we were taught in class to do it on the limbs, but when I shadowed the MA in cardiology, she had done it right here for the arm leads. And so I picked up on that and I placed the leads here. So that's something that I got corrected on, but I'm more confident in the EKG now since I got positive feedback and constructive criticism. Let's see, lots of pediatric patients. We have to do the Snellen chart, and some are infants and some are toddlers. So we have to do the infant weight scale, and if they can stand, we can do the regular height scale and the standing scale. And a necessity is getting the head circumference. So I'm getting better at dealing with the fussy babies and the ones that are squirming around and toddlers who only say no. And growth chart, it's not really documenting on it, but when we entered the information into the EHR, it automatically applies the information on the growth chart. So all we really have to do is print it out, print a label, slap a sticker on it, and scan it. And we don't scan it. We have a big bin that at the end of the day, someone comes and collects all the papers and they scan it into the patient's chart. So that's a whole different office. I'm not too sure where they're located, but that's how we do things in our facility. As always, I'm applying HIPAA, making sure my hands are clean, and looking out for things that I don't think are right. So far, so good in my facility. I would really only say the providers leave the EHR up, which in one of our scenarios, a student got called out for that, so I don't know how to feel about that. Another big thing, I set up a sterile field for a vasectomy procedure. We did sterile drape and, you know, opening the package. Oh, I still got some. I got some sterile gloves to practice. Yep, same thing. Dude. That's how I would drop items in. And I'm trying to think. Lots of ultrasounds, lots of prenatal visits. So just getting out the Doppler and making sure that there's a Chuck's pad and that there's a drape if they're gonna do a pap smear or a cervical, sorry, not the pap smear, but if they're gonna do a cervical check, then we would have a drape just in case. Another thing that I really enjoyed doing this week was being able to shadow a doctor. He kind of asked if I would like to come in and see how things are done, and I really appreciated that because I'm someone who wants to continue my education in medicine, and I think that's awesome. So happy I did that. We do specifically a lot of end of visit summaries for that provider, so he will type out a end of visit summary for the patient to go take home, and we're kind of just telling them what to do, what the end of visit summary says, so we're applying and providing the patient with information and education. So that is about it. That's all the major tasks that I performed during the week. I'm feeling more confident. I'm getting faster at inputting patient information to the EHR. What else? Okay, something I noticed I can improve on is just, again, being faster. Multitasking, for me, it's hard to input the patient vital signs into the EHR and talk to the patient at the same time. Someone recommended that I can do it outside, but I like to do it while I'm in the room just so that the provider can see everything before they walk in. We write it on paper as well as put it into the EHR, so that's nice. Next week I will be doing a bunch of vaccines, so I'm looking forward to that. My goals for this upcoming week, or my last 4 days, are to do a lot of vaccine administration and just be faster, more confident. I'm still learning a lot of things. I'm still new, and I still feel like I'm getting in the way just because I don't have a patient or I feel awkward, but that will soon get better. It just comes with time, but I'm feeling positive about everything. I have nothing else to say, but that was my week 4, and I will be back next week. Thank you.